You're also going to study from our study guides, okay? And you guys know what you've taken on your test. So if you want to go over any of your tests with me, I'm happy to meet with you guys one-to-one. We'll go over the questions, the answers, whatever. But like I said, I have a couple different ways we can do this. There's so much content. I can't review. I can't tell you what's going to be on your specific HESI because, HESIs are all over the place, but I do know what content's on there. So we can review the content, and that's what we plan to do tonight. It's going to be a short class, guys. We're not going to last through till our normal long end time as usual. So I'll just probably be about 45 minutes or so. If you guys want to hang on and we'll do some Kahoots together or something like that, I'm happy to do that. I see that we have some visitors here, which is totally fine. What I want everybody to do is put your first name in. If you're one of my students, just put your first name in the chat and I'll know you're here. And then if you're another professor, just put your first and last name and then you'll put the professor's name as well so that I can take attendance there. Any questions outlying there? You guys rocked exam 3. You really did phenomenal. The grades were wonderful. I'm very proud of you. I've already told you this, and I don't pick favorites, but this class has been a really great class to have. You guys have been amazing. And so thank you for that. I thank you. It makes my job easier to have a great group. So you guys really rocked it this quarter. You've done well, you've written well, you've done a lot. So I'm really proud of you guys. So be proud of yourselves. You're almost there. And like I said last week, you're going to be my colleague before you know it. So for you, just kidding. All right, so let's start. We'll do a little PowerPoint thingy for HESI. I started the class saying that I've got a PowerPoint, I've got Kahoots, I have some like how to take test questions. So we're just going to do all over the place tonight so that I feel like I've covered as much as I can with you. So let me share my PowerPoint with you. And remember, guys, it's a review. This PowerPoint was made by Professor Apple. She is now on campus at one of the campuses. But she's a phenomenal teacher. So her and I did this together and we've shared it together. So let's just take oops. Why am I stop sharing? Why does it do that to me? All right, so we're going to take a look at our PowerPoint first, and let me just make it so that it's big for you guys. If I can figure out what I'm doing wrong here. Slideshow move. Any questions on anything that we have coming up? All right, so you guys have Kaplan. You have to do your review for Kaplan. Eve, it's called remediation. Make sure you do that remediation so I can give you a score, okay? Because if I don't have that remediation, I can't have the score. All right, so, and then you guys will have your HESIs. You are going to get those scores probably before I do. And you are going to do remediation on those as well, okay? Because remediation, it'll tell you how much time to put in based on your score. Okay, any questions on that? You guys probably have already done HESIs. Haven't you guys done HESIs already? So you know the drill. All right, any questions you have about your particular grade or scores or anything like that? I've gotten some emails back and forth from people. I appreciate it. Just most grades are up to date right now. By the way, vulnerable populations, another one. I was really proud of this group. I was very, very, very happy with the kind of stuff I saw. You guys put your effort in and it was absolutely noted. So good work. You guys are on your way. All right, so if we look at community health, I want you guys to remember that it's always goal-oriented, our community health. Where do we have it? We have it at home, we have it at school, and we have it in the workplace. Those are going to be our 3 places for our community health. When we look at it, we're definitely going to take a look at our philosophy, and what we follow is our Healthy People 2030. What are we going to do with that? Health and longevity for everybody, right? We're going to look to prevent disease, prolong life, promote health and efficacy. And we're going to do this through organizations like the World Health, CDC. What do you guys remember about World Health?
Aren't they the ones that monitor the reactions to immunizations and stuff?
Yep. They're going to be worldwide places. So they're going to be stuff that impacts everybody, right? CDC is going to be our Center for Disease Control. Who is that going to monitor? The whole world? No. We're going to be more focused on what's going on in our world. CDC can say we're having a pandemic, right? Because they did that. through COVID. So those kind of things we think about with CDC. We're going to look at our data collection and interpretation. This was on one of our tests. Remember, our primary goal when we're collecting data is to get information about our community. So we're looking for our data that's missing, our existing data, and our health problems. We look at our primary, secondary, and tertiary. What can you guys tell me about primary prevention without looking at the screen?
Primary is by vaccinations.
Good. What else?
Teaching.
Teaching also, yeah.
Who are we teaching to?
The community.
Yep. Community, the sick community or the healthy?
Healthy.
Good. Good. You're going to be looking at that healthy group of people, right? We're going to have our vaccine clinics. We're going to educate about things that are coming up. We're going to do our local health departments. We're going to have our rural health. Then we have our secondary. What do we remember? Secondary is always.
Screening.
Yep. This is where we may see education about a condition that we're screening for, right? Who does our secondary screenings? Most of the times we'll have clinics that are going to screen. We're going to look for blood pressure. We're going to look for, what else can we look for? Diabetics. We're going to do weight screenings. We're going to do that kind of stuff. And then our tertiary, remember, we're going to be doing what with tertiary?
Treating.
Yep. Remember, T for treat. So the kind of things we'll see with treating, okay, remember, you can educate in tertiary. Somebody give me an example of tertiary education.
Diabetes, how to do your insulin and your medication.
Your checks, your glucose checks.
Yep,
Right.
perfect. Yep. That's a really good one.
Mammography.
Right. So mammography is not going to be tertiary. Remember, my mama,
Secondary.
yeah, secondary. Sorry, I can't even speak. Our mammograms, right? If we were treating, we were doing breast surgery. That's going to be treating, right? It's going to be tertiary prevention because we need something done based on our mammogram findings, right? Okay. Health promotion is our big goal as a community nurse. We're going to make sure we enable people to take care of themselves, right? What was that group of people? Does anybody remember where we have to make the appointments? We can't tell them make an appointment 3 weeks out because they won't.
Native
people.
Native Americans, right? What are we going to think about with our immigrants? What are some things we think about with immigrants that is important?
Mental health.
Mental
Trauma.
That's going to be our refugees. That's true. What else?
Lack of insurance.
Yep.
Language barrier.
How about education? What do we know sometimes will occur? And this is across the board. This isn't just immigrants, but what do we have to be sensitive when we're educating to people? What do we have to teach to?
To their level of education because
Yeah.
they may not be at a higher level.
Yeah, and maybe they don't know how to read, right? So we're going to be careful with that, right? All right, good. When we look at our environmental, we're going to look at our environmental and our primary, secondary, and tertiary prevention we're going to look at. So if we're looking at a living space or a home radon, what's going to be home radon? What level of prevention?
Isn't that secondary because you're screening for it?
Yep.
Mm.
And then when you find it, what do you do when you find radon in a home?
You put the remediation fans in there.
Yeah. So anybody who's ever bought a house, you've probably had to do this. You leave the radon test for 3 days. And then when we look at like our fireplaces or our gas space heaters, we have to be really careful with what kinds of things with that.
Carbon dioxide poisoning possibly, or
Right, good. And then any of our vented dryers, when we look at our water, remember our lead pipes? Right, that's our number one concern with our kids. Remember Healthy People 2030.
Lead
Go ahead.
lead poisoning would be.
Yep.
Oh,
What else? So how would we assess somebody? What are we going to do if we're looking at their water supply?
If it's clean water. Mhm.
Good. How would you know it's clean?
If it's not brown.
Okay, if it's not
You
brown.
test it.
Yeah, you can test the water. What are you going to test it with, Heidi?
I guess, there's, how do you call this? It's some sort of like a strip that you put in the water. I don't remember the name. Maybe with that, I would say.
Yeah, you have tools and we can do that. What level of prevention is that going to be when we're checking somebody's water?
Secondary,
Why is it secondary, Jacqueline?
because it's a type of screening. They don't have the problem. You've already educated them on what the problem could be. So it's the screening
Good,
portion of prevention.
good. And our smoke detectors, what kind of prevention is that going to be, our smoke detectors?
Is that primary?
Mhm. Yeah, tell me why it's primary. You guys are right. Why would it be primary?
Because it's prevention and the fire hasn't happened yet. Or we're not testing for a fire. It's just to
Yep.
prevent.
Good. And our smoke detector, when it goes off, that's where our secondary prevention sort of comes in because it's screening for the household, right? Get out, or there's a fire or something like that. Good. We look at infectious disease. Important to remember our infectious disease and our antibodies, what we do with those. You are going to need to know medical, surgical kind of information on this HESI. So you may see something about preventing smallpox. What do we do with that?
Vaccines?
Vaccines.
Yep, we're gonna do a vaccine. Remember, when you do the vaccine, what that's gonna do is it's gonna create some antibodies. So when you get to it, you have something that'll fight it off, right? Do not forget your epidemiological triangle, okay? Those are our three different things. Remember, our host, our agent, and our environment, right? We have those three things working for us. Make sure you know how they all work together. And our agents are going to be more of our like viruses and our vectors and things like that. Our environment is what's going on that's going to cause somebody to be more susceptible, as well as the host, because are they immunocompromised? Do they smoke? Do they have asthma? Those kind of things, right? All right, so these are some things I want you to remember with infectious disease. You're going to look at vaccines. You're going to look at our TB tests. What do we know about those TB tests? Who are we giving those to?
Migrant workers, people who work in the hospital.
Inmates. Very good. Very good. Remember, don't forget prison because
Mothers who have babies.
yeah, good. Because remember, anywhere where you're close contact with somebody, you could get TB. So we're going to, screen for that. Our vector-borne things, terrorism, like our smallpox, those kind of things. And how do those things transmit if you're pregnant? Which ones are going to transmit if you're pregnant? I'll go to the baby.
Syphilis,
Yep. What else?
HIV.
Mm-hmm. So both of those HIV are going to treat with those antivirals, right? If they're going to have a vaginal birth. All right, when we look at our barriers, what do we have that's going to help us? We have our Tamiflus, we have our vaccines, and we have our shingles. We have all those kind of stuff, right? That helps us with our preventions. Oopsie. Skin reaction, I'm not going to do that one. All right, in our incubation times, and we're looking at our different stuff. Flu, we're going to have an incubation time of 1 to 4 days. With our anthrax, we're going to have 1 to 7. TB, we're going to see 2 to 13 weeks. Okay, so it's a long incubation. And then our SARS, we know this from COVID, is going to be our 2 to 7 days, right? Incubation period. I don't think you'll see much on COVID on the HESI because it's still kind of we don't know enough. Influenza A, what are some things we look at with influenza A? We have those people that are always vulnerable. Who's our vulnerable population always with
The
any viruses?
The elderly.
The elderly.
Immunocompromised
It's not
patients,
Who else?
pregnant women, pregnant
Children.
women.
Yeah, babies, kids, right? Those are the ones who RSV on a baby is going to really impact them, where for an adult, it may not have that same impact. Okay, so think of that when you're seeing a question about who's my most vulnerable. Here's just a little picture of pneumonia. Here's our TB test. Remember, we know we measure in our millimeters, right? We see, is it positive or negative? What do we do if it's positive?
X-ray.
Yep, chest x-ray, yep. And then we'll treat if we see that. Rocky
also
Mountain
has to
spotted
be-
fever, we're starting to see come back around, guys. What I will tell you is it's usually a tick-borne illness, can present in so many different ways. I have a story about Rocky Mountain spotted fever. One of a family member of someone I know, so he went into the ER and he had inflammation of the brain. They had no idea what was going on. He wasn't sick. They didn't know. Come to find out he had Rocky Mountain spotted fever is what infectious disease says. How? He didn't know he had a tick bite, but what they did say is all the side effects, there's so many of them that you may not know them. So it's something to keep an eye out on. STDs, we talked a little bit about those. Now our most common ones, our bacterial ones are going to be our chlamydia, gonorrhea, and syphilis. What can we do if they're bacterial?
Antibiotics.
Antibiotics.
Good. Our virals is going to be a harder thing to treat, right? All right, when we look at our community assessment, this was on our last exam, so just remember, we're going to be looking at a ton of things. We're going to look at incomes, we're going to look at our patterns, we're going to look at our risk findings, we're going to look at our clinic financing, how are we able to treat the community, what kind of agencies do we have? This is where your windshield survey came in, really helpful. When we're looking at our school nurses, what are some things we take a look at? We're going to be looking at lice, depending on your state. We're going to be looking at scoliosis. We're going to be looking at eczema. We're going to be looking at psoriasis. These things now, remember, when we detect them, we are not necessarily treating them, but what would we do if we said a kid, we did a screening on scoliosis and saw positive screening? As a school nurse, what are we going to do?
Notify the parents.
Notify
And give them some
parents?
information.
Yeah, what else are we gonna do? We're gonna tell them, but we're not just gonna tell them. What else are we gonna do?
Provide information to where they might be able to get like a screen, I guess. Or
So we'll
see-
screen we'll screen in the school, but yeah.
Refer
you
to
can- yep.
PCP.
Shampoo?
Yeah, lice, you can do the shampoo. You can recommend depending. It's really, you gotta be careful what you say because you don't want to offend people. And unfortunately, lice is one of those. Everyone gets offended. I don't know why, but scoliosis, if you find it and you refer them somewhere, what are you going to do when you refer them somewhere? Same with a vision screening and a hearing screening. After you refer them,
Give them some information.
Geriatric.
okay, we
Follow
gave
up.
them the information. Now what?
Follow up.
Very good. Very good. Your follow-up care is going to be key here because maybe the parent doesn't know how to call. Maybe the parent doesn't speak English. Maybe the parent doesn't think it's important, all those things, right? Good. So we're going to see that stomach ache pop up in school nursing all the time. What do we know about stomach aches?
Sometimes it's because of neglect at home.
Mm-hmm. Could be neglect at home. What else could it be?
Stomach bug,
Stomach bug. What else?
bullying at school.
Yep. What
they
else
don't
could
want-
it be?
They don't
Yep.
want to go.
Food
Poisoning.
They could be,
Food poisoning. They don't want to go to school. That's a big one.
they can be
Ma-
hungry.
Big
Right.
eye.
Good. First question that I always ask a kid when they're in my office, what'd you have for breakfast? And a lot of times they say nothing. With the high schoolers, I asked, did you have lunch? No, they never do. They have soda or something. All right, so think about that when we're looking at that with our pink eye. We know what we're going to do with that in our treatment. Headaches is another one you'll see all the time in schools. We take a look at skin and their skin assessments. Teen health was a big one we talked about early on. Remember, we have our mental disorders, substance use. What else do we see that people sometimes forget among our teen population? Big worry, it starts with a V.
Body image.
Vaping.
The vaping, yeah.
Well, vaping is a concern, but it's something else that happens. And sometimes we don't think about it with our teens, but we see it frequently.
Violence?
Very good, Sylvia. But yep, our violence. We see that because remember, they're teens. And so they're maybe okay with being hurt or abused by parents, by relationships, by whatever, because they don't know that that's not the norm, right? Think about our kids that come from domestic abuse. We know that that is a trend, right? We know just like alcoholism and drug use is a trend, there is a genetic trend with that. So with violence, we sometimes see that because they don't know. STDs, big one with our homeless adolescents. What are we gonna make sure we do with them? What do they have to do?
Mm,
What have we found a relationship between education and something else?
You can't rely on abstinence. You have to teach them safe sex.
True. But we're talking about education here. What do we know about our pregnant adolescents? What do we want to make sure they do?
that they're
They
getting
continue the
access
education.
Yeah, care, healthcare.
Get healthcare, what else?
proper
Finish
nutrition.
Education.
Yeah,
Keep them
good,
in
yes, sir.
school.
I heard you. Yep. Finish your education because we see a relationship, right? Don't we see a relationship with lower education, higher poverty, right? So don't forget those guys. Motor vehicle is another big one. Suicide, unfortunately, is just, they don't know what the world has to offer. All right, so alcohol, drugs, tobacco, violence, we talked about that. Just a reminder here for any of us that, oh, hey now, any of us that have teens, we know this. It's a transitional period. Would you move? It's a transitional period, biological changes happening, developmental. They see social with our social media and all of that. They are seeing all kinds of things that they should not be seeing. Has anyone heard that horrible story about that man who was a police officer and he catfished a girl, went to her home and then killed her parents and her aunt, stole the child, and thank God there was a neighbor that was paying attention and called it in, and then she was saved, but she probably would have been killed too. So that's a great example of community assessment. You keep your eyes and ears open in any community, whether you're a nurse or a neighbor or a nurse in a hospital. Okay, guys, you got to keep yourself on all the time. We know our diets are healthy diets, what we're going to focus on there. We know that when we're in stress, a lot of times anyone who's ever been a nursing student, which every single one of you is, you're always stressed. So might you have that like, I don't know, or is it chronic? So you're like, I'm always hungry. I always need to eat something. What's going on? But when you're in that acute stress where you're taking the test, like, I can't even eat. I can't even drink. This is awful, right? So think about our 2 levels of stress there and how we manage, right? So hunger is definitely not a priority for us when we are taking that test. We're like, who cares what's for dinner? But then when we're in that chronic stress, we're like, uh-oh, we have to figure it out. What are we going to do? I'm going to just go to McDonald's, get the quickest meal I can, so the whole family will be fed and we'll be done, right? So think about diets and that. We talked about coordination of care. And we'll look a little bit about geriatrics. What do we know about our geriatric population? I'm trying to go quickly, guys. I'm not purposefully, but I know I am. What do we know about our older people?
Mm,
What do we worry about with them?
their
Falls.
safety.
Abuse.
Abuse,
Depressed?
falls,
Falls,
use,
abuse, falls,
Nutrition.
nutrition.
Yeah.
Remember, we're gonna be checking their fridge, make sure it works, make sure the stove shuts off and they don't just leave it on for days and days. We look at their skin, right? Because they've been in the sun for 70 years. So what has happened to their skin? We know we see Parkinson's arise with the older population, can be young, unfortunately. But what about our hydration when they're doing exercise? Are they drinking? Because a lot of older people they'll forget to drink. Primary, secondary, and tertiary, we're going to do with them. We're going to do a ton of educating on what kinds of things.
Eating, being safe.
Yep. Juan, you said something that's big. What are we going to teach them about? In the
falls, like,
Yeah,
huh?
good.
Yeah.
Yep. What kind of
Yeah,
things are we going to
just
teach them
like the
to prevent them?
surrounding areas, rugs, you know, if they have an oxygen tank, just, you know, all that good stuff.
Good. Oxygen tank is going to be one of those that we worry about, fires too, right? All right, so we look at with our diabetics, we're going to take a look at their feet, their skin, renal functions. Christmas light flashing is something that happens when they are hitting a dementia state. I wouldn't spend too much time on that. Know that sometimes they're elderly, they're out of money, so they have to go live with their kids, and that puts pressure on them, right? So we know about our community resources. Hospice, what's our focus with hospice?
Comfort measure.
Comfort, but what else? Starts with a D.
Dignity.
Very good. Dignity. We want to make sure that we're giving them respect and the dignity that they deserve, right? Okay. Home environment, we talked about this a little bit. When we go into that home, we're going to see tons of things. Why is it so good to do an assessment in the home? What do we find when we go into a home?
Give you multiple things, drugs, violence, dirty house.
What else do we know when we go into somebody's home?
The type of environment that they have, you know, within the family.
Good. We know who
Yeah.
lives there, whose family,
Yeah.
who's not.
If you get to snoop into the bathroom, you can see the medicine cabinet, the kitchen, food, what kind of food.
Yeah, so what you want to do is you don't want to go into their bathroom and say like, let me see what I can find. What you want to do is you want to say to them, and I know you know this, but you want to say to them, hey, can you show me where you keep your meds? And then you can help go through them and make sure they're not expired and they're what they're supposed to be taking, right? So rule of thumb on a home environment is you want to see the drugs every time you go, because maybe they just put on a show for you and you have to be careful with that, right? All right, faith and hospice nursing, we talked about a little bit. What I want you to know with our community health disasters, that bioterrorism, the radiation, our pandemics, we've just gone through one, so I'm not gonna spend a ton of time on that. Remember our natural disasters, those things that just happen, right? That may not be human interference. Something like fire, depending on what kind it is, can go both ways, sort of. And when we're triaging, we know that our primary, when we are triaging, regardless where we are, what is our rule of thumb with triage?
ABC.
Very good. What's ABC again?
Airway,
Breathing,
breathing and
circulation.
circulation.
So our priority when we're looking at someone, if they can't breathe, that's our priority. Okay. If they're being abused, that's a priority for sure. But if they can't breathe, we're more worried about them breathing because they're not going to survive, right? So think about that when you're looking and you're just thinking, I wonder. All right. Migrant workers, we worry about what with our migrant workers really bad. There's tons of pictures here. Starts with a P.
Pesticides.
Good. Pesticides. I want you guys to look at this picture right here in the middle. Remember their living arrangements, what they may be. Right? Really tight quarters. We might see some TB there. We may see infectious disease being spread rampant right there. And remember some other body system that we worry about with our migrant workers.
Musculoskeletal. Scoliosis, the back.
Yep. Musculoskeletal. Very good. And remember, because they're bent over most of their lives. What we see with our rural communities, we're going to have that decrease in leisure time. We're going to be working tons. Everybody knows everything. So we are not going to be necessarily getting accurate reports, right? We're going to really pursue and see what's going on there. We know mental health and abuse is very underreported. And what else do we know with our travel distance? What does that cause?
Patients not getting care from doctors because they can't get there. They're too far away.
Good. So we're going to see a lack of care. We're going to see an increase in what kind of diseases?
Chronic diseases.
Very good. Chronic diseases because they're not going to the doctor to get checked, right, guys? Very good. All right. We talked primary, secondary, tertiary. I will tell you, you will see this on the HESI. Know your primary, secondary, and tertiary, okay? Substance abuse we did in our class. Who's at risk for substance abuse?
The adolescents.
Yep. Who else?
People's family history of abuse.
Yep.
I mean,
genetic.
well, abuse, yeah, genetics.
Yep. Who else?
Homeless.
Go along that path a little further. Homeless, and what do oftentimes homeless people have as well?
Mental disorders.
Donors.
Disorders.
Or mental illness, right? We see mental illness and substance abuse because it's a way of coping, really. What do we know about our vape pens? What are we going to teach those parents who say, hey, I'm vaping, I'm not smoking a cigarette anymore? Isn't that good?
Yeah, if a child ingests the oil, it can kill them.
Good. You guys have learned so much. See that? All right, homelessness, we know. We've talked about it. Cycle of abuse, I need you guys to remember that you are all mandatory reporters. You need to report regardless where or when you see that abuse, right? That is your role as a nurse, and so you are going to report. Worst case you do is report and they find nothing. But lots of times you report and they'll find something. So just keep that in mind, that communication, you want that open communication as much as you can. Things we will look at sometimes with abuse in children. We'll see that we're going to do our screening for risk factors and problems, which is going to be our what kind of prevention?
Secondary.
What? We're going to reinforce parenting skills. Where do you think that would come in? Reinforce, not educate, but reinforce.
Tertiary.
Somebody said something.
Tertiary.
Tertiary? Nope, you're not there yet, but you're close. When we're educating on those parent skills, what would that be?
Primary?
Good. When we're going at that secondary level, we're going to reinforce and say to them that what you are doing is a good job. What does that do? That reinforces for them, okay? And then we look at guidance where we may see, where are we seeing this mistreatment? We look for infant behaviors, right? We need to teach our parents what is normal, what is not normal. If we teach what's normal, they will know what is abnormal. Partner violence is another one that we will look at as community nurses quite a bit. Mental health, there's tons and tons of things. Our most effective way to work with our mental health is going to be broad openings, clarifying. I hear you say, that kind of thing, accepting, be careful of our biases. We talked about this tremendously throughout the quarter. Culture, we have cultural sensitivity teaching. We talked a little bit about our time and orientation. Remember our faith and our foods, how that's going to impact their health care. How can we help? We know our Native Americans, we talked about that earlier. We know that we have to be sensitive to our Hispanic culture. We need to be sensitive to as many as we can. What do we need to do when we're looking at a culture other than ours?
If we don't know, ask.
If we don't know, ask. Absolutely. What else do you know?
We need to shed our own biasness so we can effectively treat the patient.
Right. And what we know as nurses is we're not going to get rid of our biases. What are we going to do? Is we're going to know what they are. That cultural competency is ongoing. You cannot learn that in a class. So you need to work on that as you work on your nursing, just like you work on your CEUs, right? All right. So that is the end of my PowerPoint. Would you guys like to do a Kahoot? What I'm going to do with the Kahoots is I have a bunch of them. So let's do like 3 or 4 questions from each just to get a little taste of everything. Does that sound good?
Yeah.
All right. So let's pull some up for you. I'm going to stop sharing and pull it up. Any questions up till this point? Guys, I know it's a ton of information. Anybody who is here, wow, we have a huge group right now. Anyone who is here, I said at the beginning, please put your name and professor in the chat. If you are mine, just put your name because I know who you are. All right, let's do some Kahoots. I said in the beginning, and I will reiterate this, one of our best tools for the HESI is our HESI book, our study guides that we've had throughout the quarter. If you guys have been studying all along, you're going to do just fine. Let's see. All right, so some of these Kahoots we've done in class. So I'm going to just cut them kind of short, you know. But like I said, we'll do like 3 or 4 together from each one. I have a bunch of them, so let's just take a look at. Let's do primary, secondary, and tertiary. We'll do that Kahoot first. And for some reason, my Kahoot is like not liking me anymore, so it wants me to pay. So if you can't answer the questions in the Kahoot on the actual Kahoot, what I want you to do is answer in your head, and we will go over it, okay? Because it's like capping out for some reason. I don't know. Kahoot's on to me. Oh, hey, now what happened to my screen? Oops. I don't want to load it. All right, we ready? I'm gonna start it. And I think it's gonna be not cooperative tonight, but see, maybe it will be. Oh, yes, it looks like it's cooperating. All right, here's our pin loading. I will add you guys. All right, here's our pin. It's gonna be 734-853, although that seems a little like missing a number. Try that, 734-853. Oh, good, it worked. All right, our first question is going to be a definition. So let's see how we do. Okay, we're going to start and then you can log on or just watch. Define primary prevention. Actions that prevent the initial occurrence, actions to reduce the occurrence and establishment, screening to identify diseases, managing disease post-diagnosis. Very good. What was the word in blue that told us it was not primary?
Screening.
Screening.
Good.
Screening.
Yep. Remember, our actions to reduce the occurrence and establishment of chronic illness. What is that going to be? Our yellow one. Actions to reduce.
Tertiary, because it's treating.
Secondary.
Wow, we're all over the
Tertiary, 'cause
board.
it's
Go ahead. All right, so actions to reduce the occurrence of a disease.
Secondary.
Good. Why
But
is
it's
it
to
secondary?
reduce. Because it's to reduce. It's already happened, but it's to reduce.
And what is that action that we do to reduce the occurrence and establishment of these illnesses? We're gonna, yeah, we're gonna screen to lower those rates. Okay, here we go. Next one. The level of prevention is a primary prevention. Nursing assessments and care in a home, Hep B vaccine, teaching a client in rehab how to maximize use of abilities, and encourage regular medical checkups. Alrighty. That is not correct. Oh, yes, it is. So sorry, so sorry, so sorry. All right, our Hep B vaccine is going to be our primary, right? Nursing assessments and care provided in a home. Why would this not be correct?
Because it has an assessment, so that would be. Scary.
That will
Assessment's
be
not gonna be.
secondary.
There's a word home.
Yeah, secondary.
Okay, what do we know if we're in the home?
More
They're
likely
already sick.
Yeah.
They're either sick or they're recovering or something, right?
Mhm.
We're not we don't, as nurses, just go knocking on people's doors and say, hey, I'm here, right? So think about, they got something going on already. With the nursing assessments and care, I would assume that we would say that would be tertiary, really, because we're providing care, right? And so that means we're treating them with something. Teaching in a rehab, we all know they're in a rehab, they're already there, so we're doing our tertiary again, okay? And then we go to our, we're not gonna do this again, we just did this one, hold on, I'll skip it. Oh, that was an example, I could have done that one. Oh, okay. Self-breast exams would be considered which level of prevention? Primary, tertiary, secondary, primary, and secondary.
Professor, my Kahoot is not working, so I'm putting the answer in the chat.
Good, okay, that's a good way to do it. Ooh, we were torn on this one. Somebody who picked secondary, tell me why.
It's a
Because
screening.
you are screening your breast.
Mm-hmm. Mm-hmm.
You're
You're
looking
screening.
for something.
Right? What would be with self-breast exams? How could we make that primary?
Educating that you have to self, like you have to check yourself.
Yep, good. We teach them that you have to do it, right? But once they're doing it, they're screening, right? Very good. Chemotherapy for cancer treatment, what kind of prevention? Primary, tertiary, secondary, primary, and tertiary. Ooh, we had one who was secondary. What I will tell you is very good work, guys. Why is this tertiary? What is the word in there that we know it is?
T with T.
Already have a cancer.
Treatment.
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 Yep, T with T. I like that. Treatment, remember? Okay, let's do another Kahoot. So we'll stop sharing here. And we will do another one of these. Right, this one, we'll do immune systems. How about that? Let me get out of here. All right, here we go with our immune systems. All right, there's our pin. Help me, I like that. You'll do fine. You'll do fine, whoever help me is. All right, immune system. Here's a good one. What route of administration are we going to use for our Tdap, Hep B, and IPV vaccine? Is it going to be IM, sub-Q, IV, or sublingual? We all should know this because everybody should have gotten Hep B. It's not subcutaneous. Think about it. Your shoulders always hurt after your Hep B. Remember that? I remember. That was a long time ago. Or and DTaP, if you ever poke yourself with something, a dirty metal, they'll make you every 10 years go get a tetanus. All right, we are on to, that's a little video. Active immunity vaccines are what? Require direct exposure to an antigen acquired through a killed or weakened form transferred from another person, cannot be obtained. Active immunity. Oh, we were all over the person. Okay, active has the word what? What do we know if it's active?
Alive.
Yeah, it's not laying dormant somewhere, right? So you're gonna have either direct exposure to an antigen, or we're gonna have a weakened form, right? Where we get a little dose of it, and we have to have our body produce the antibodies to it. Good. COVID was not active. Active immunity, we're gonna go back to this. Active immunity, this is a definition. We'll skip that because we just did an example. Why is this repeating itself? Hold on 1 second, guys. What is artificial active immunity? Vaccine induced, found in mother's hugs, passed from the mom, or passed in colostrum. Good work. What did you find in the 3 other answers that you could know by process of elimination? These 3 all have the same thing in them. What is that?
There is no
Mother.
Mm-hmm.
Yeah.
So even if you had no idea, right? All 3 answers are exactly the same. That's a test taking skill. If I look at 3 answers and they're all the same, probably not the right answer, right? Good. And it's artificial. That's the word right there. Nothing about a mother is artificial. I don't think I can say that as a mother, but maybe some people find mothers artificial. I try not to be. All right. We're gonna go on to multi-select. Yes. Due to migrant families working from job to job, their health records do not follow them, leads to this type of service, which is a fragmented service. It's a service that areas and treatments such as TB and immunizations, vaccines, chronic illness management, and immune serum. It's going to be multi-choice here. All right, so what ends up happening is this. A lot of us picked vaccines. So yes, but the thing is that we don't see such a trouble with vaccines as we do with our actual immunizations that they've had already, right? Because we can vaccinate. If they're not really sure, we can usually vaccinate, but usually they'll know, they're gonna know what they've had. But we see that we have treatment for TB, and a lot of times we're going to see they don't know what they have. So that's going to be a problem. And our illness management, because they're coming from other countries or they're coming from migrant areas, either way, and they're going to be having those records that don't go with them. So they're going to be really confused. So what were they doing for their diabetes if they don't remember? What were they doing for their hypertension? Well, you don't have any records. So that's a big problem. Okay. So it'll be our 2 areas there. All right, we'll do one more on this one. Oh, we already did this. Skip that one. Innate immunity is going to be innate immunity. Barriers like skin and mucous membrane, something you're born with. All of these includes the cough reflex. Oh, good. Most of us got it. It's everything. It's something that we're born with, right? It can be our cough reflex. We're born with that. That helps us get it all out. And then we have our barriers. We have our mucous membranes and we have our skin. You couldn't get better barriers, right? Or immunity than your skin, right? Okay, good work. I'm going to stop on our infectious disease there. I feel like we've covered quite a bit. I don't want to keep going and going and going because I don't want to overwhelm you guys. So what I will ask at this point is there any last minute questions for everybody?
So would you suggest us to do the Kahoots for the whole year, rest of the semester, and the notes? Would that be a good way of studying the HESI, or do you know a different way, or just the HESI book, well, the green book that's online? Like, what would you suggest?
That's multi-select. That would be all of the above.
Okay, letter D it is.
Yeah. So it would be everything, guys, because this HESI is gonna cover what we've covered in class for sure. It's gonna be covering some of your med surge, is gonna be resurfacing. And that's a good thing, because you guys know it already. You've already passed that class. So think about these things as you're testing, okay? Think about our major different levels of prevention, our ABCs, our infectious disease, you guys all wrote a paper on infectious disease. You're so fluent in it. You could be helping the infectious disease team on one of those TV shows by this point, right? I bet. All right, any questions that are outstanding? To my class, I want to say cheers to you. You got this. Good luck. To everyone here, good luck. But my class has been a special class, so thank you. You guys got this. Any questions, reach out to me. I'm always available, okay?
Thank you.
Thank
All right, good luck,
Thank you,
everybody.
Professor.
Bye.
Thank you.
Bye.
Thank you.